Welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center, and I'm here with Dr. Michael Amador from Sunrise Vista Behavioral Health.
It's a pleasure to be here, sir.
Yeah, and we've already started our conversation, so this is just a part that we're recording. We're halfway through. So we were just talking about baby steps, which may sound surprising, being the CEO of a psychiatric hospital, that instead of saying, quick, get your person to the hospital, we're like, well, no, sometimes you have to get better little by little and take a measured approach.
Well, you know, it's that process of baby steps, as we talked about earlier, that has the long-term positive effect. Mm-hmm. And so patients, for example, when they come into a psychiatric facility, we begin that baby step process. We begin by evaluating their medications. We begin by putting them on 6 hours a day of therapy. Mm-hmm. You know, as mentioned, we have a short amount of time to do quite a bit.
Right.
5 to 7 days is what we have to put the patients on the steps that they need to, so they can follow that after they leave the facility.
Yeah, you were saying that for one thing, no one wants to be there.
Exactly.
Which I think is, and we're already off topic, so this is going to be a great show, which I think is fascinating because we already talked a little bit, again, before the cameras rolled, about the troubled teen industry and the fact that you can pay $20,000 and go to this camp where they'll deal with your mental health needs. And some of them are specialized, like they'll do EMDR, there's yoga. But the other side, which is, okay, your insurance will pay for a psychiatric hospital stay. Everyone was like, no, absolutely not. But what you're saying is if the patient can kind of get themselves into the mindset of, well, this is sort of a vacation. Because for one thing, you said you all don't use restraints there, which is...
No, we don't.
Which is a huge risk for someone going to a psychiatric facility. Like, yeah, it sounds great, and I'm going to end up strapped to a bed for 4 days.
We actually try to do the best we can, again, in a short amount of time. So from day one, we begin the discharge planning process, the aftercare process. Mm-hmm. And we evaluate all the medications that the patient's on to ensure that the medications that they're on are appropriate. You know, a lot of hospitals, they'll admit a patient and just continue meds. Mm-hmm. What we do is we try to evaluate what meds that patient is on, because what worked for them last month may not work for them this month. And so we check their medication. We do a complete history and physical. We have 6 hours of programming per day, 2 hours of rec therapy, 2 hours of social services, 2 hours of nursing. So we try our best to do as much as we can in a short amount of time. So it's kind of a crisis intervention, but also putting them on that baby step process so they can continue on after they get discharged.
That makes sense because it's a stressful situation, of course, for the patient. So you're not like, here's everything you need to change immediately. It's more like, okay, while you're here, we're going to move quickly, get you out of crisis.
Exactly.
But at the same time, here's the steps, and we'll start this process here, but you'll have to continue it afterwards.
Our goal is to get them out of crisis, get them stable, ready for outpatient or for partial hospitalization or for IOP. Our goal is mainly crisis stabilization.
Sure. And you know, a lot of my patients at Ascend Health Center know IOP and PHP, and many patients who, because we get a lot of patients with treatment-resistant depression, they know all the lingo. And I was already realizing I do have a patient that should go to your IOP, especially since you all are in Stark County. But can you explain the differences between those? Because what you said too is some patients don't quite need the hospitalization, don't quite want it. So what are other alternatives other than, you know, just having therapy weekly or whatnot?
Partial hospitalization is a lot more intensive than, for example, IOP. Mm-hmm. Partial hospitalization is the step right below inpatient. So normally it works as an alternative to inpatient. The patient is in a crisis, but not severe enough to be inpatient, but severe enough where they need an intensive following, where it's about 4 to 6 hours a day, Monday through Friday.
Okay.
Whereas IOP serves as a step down, especially if you have a short stay in a hospital. IOP works real well because it's intensive outpatient. Mm-hmm. They have group and they have a therapist there 3 times a week. So it's less intensive, but yet more intensive than once a week counseling or once a month counseling.
Right. No, that makes sense. At our facility, the most intensive we can do is, okay, you can see the nurse practitioner or the psychiatrist once every few weeks, and then we have group therapy once a week on Wednesdays, and then individual therapy. But often it's that case where, okay, you don't necessarily need hospitalization, but you need a little bit more than what we can provide.
Exactly. So. And so you have all these different steps. You have inpatient, you have PHP, you have IOP, and then you have counseling. Mm-hmm. And the least restrictive one is counseling, which is once a week or once a month. But most patients, especially after an inpatient stay, they require either PHP, which is a partial hospitalization, or the IOP.
Okay. And do you think some of the stigma of a psychiatric hospital is that loss of control, where it may start out as, oh, you just need to come in here for a day or two, and then before you know it, the patient's there for a week or two? Because I think sometimes there's a book I like called This Won't Hurt a Bit. In healthcare, often we do have to fight the temptation to sugarcoat things.
Believe it or not, our greatest challenge in getting their patients discharged is not the patient, it's placement issues. So oftentimes a family don't want them back, or the nursing home don't want them back. So we don't have a place to send them to. And so we end up keeping them longer than we really want to, because we have placement issues. But most cases we're able to get them out within 4 to 7 days. And again, it's very intensive, but psychiatry in itself has a stigma associated with it. So when you get into a hospital, especially if it's your first time in an inpatient facility, it's scary because it's a locked facility. You feel like your rights have been taken away, although you have many rights that we still try to protect, but it is a locked facility for your safety and for your confidentiality. But it's scary for a lot of patients when they first enter a psychiatric facility, and of course immediately they want to get out because they're afraid, they're nervous, anxious about being inpatient in a mental health facility. Once they come in and they meet the therapist, the doctor, they're able to get involved in group, that fear decreases quite a bit.
Okay. So what are the benefits of that inpatient care? Because we've already mentioned, and there's a stigma with it sometimes, patients can be scared, there's that fear of, will I lose my rights? So what are the good things that can happen being in, as you said, a locked facility, as opposed to just coming and going of what you need or what the patient feels they need in psychiatric care?
Well, focus is extremely important, and when a patient comes into a psychiatric facility, they're focused on themselves. They're focused on their treatment. They're focused on their mental health. Whereas if you're outside, there's so many things that are distractions. When you're in a psychiatric facility, you're focusing on that exact mental health problem that led you to a place of crisis. And so what's positive about it is that you're able to get a crisis intervention in a short amount of time to help you deal with the pressures outside the facility. As you know, all of us deal with extreme pressures outside the hospital, and there are so many distractions. When you go into a facility like ours, you focus on your mental health, and we're able to put all of our attention, all of our energies toward trying to get you to a place of stabilization, so you're able to go back into the community.
Okay. No, that makes sense.
And you're in a safe environment. It's locked, so you're in a safe environment where you don't have folks coming in or folks going out, and so it keeps you focused on your treatment.
Well, you can think of it too, because every drug has that black box warning of this could make you feel worse.
Correct.
So it gives you a chance to try some of these medicines in an inpatient way where there might be side effects or risk, but because those are taken care of, we can actually move the envelope. Because there's a lot of our patients at Ascent Health Center that will say, well, I want to try this, but I'm worried about this side effect, or what if this happens? So. And
that's the good thing about being in an inpatient facility, is that you're able to try new meds or even a new strength and have observation, and you're there being observed 24 hours a day. So again, it allows you to focus 100% on your mental health problem that led you to a crisis.
I mean, I'm thinking of it more as a retreat center at this point.
Well, it is different, because in a retreat center you're more in a relaxed setting. In an inpatient facility, you deal with issues that you've been harboring for years.
Right.
You deal with sensitive issues that a lot of times you don't want to in therapy, and you're having to also deal with other patients that are in the milieu with either the same or more severe problems than you have. So it's a little more intensive than a retreat, but it's definitely good for you, because it allows you to focus again on the crisis that led you to be in the hospital in the first place.
And sometimes just being separated from your environment does help, because regardless, that environment is at least part of the reason that brought you to the psychiatric facility.
We tend to, as human beings, we tend to ignore things and think we can just put them under the floor.
Right.
If you don't pay your light bill, eventually you'll have your lights cut off. You cannot ignore things. So you cannot ignore your mental health. If you ignore your mental health, you eventually you will deteriorate to a level of crisis.
Right.
And so what we do is we focus on that mental health crisis that led you there in the first place, get you stabilized, and get you back in the community as quickly as possible.
Right. At Ascend Health Center, that's what we say about the ketamine infusions. That a lot of times it'll just strip all the protections that the maladaptive protections, we should say, that you've formed, and it's almost like talking to a blunt therapist for days. That this might be, you might end up being more irritable at first. You might even have increased anxiety as you start the treatments, because it does sort of act as a mirror of letting you see, okay, what's actually going on. So you can focus on the root causes instead of like, oh, let's just focus on this easy symptom instead of really addressing what's going on inside.
It's a huge challenge, not only for the patient, but for the staff and for the physicians, to be able to do as much as you can in a short amount of time. And so our staff at Sunrise, I'm very proud of them. I mean, our nursing staff, our clinical staff, all our ancillary staff, they work for one purpose: patient care. One of my biggest pet peeves and passions is that let's make a difference in these patients' lives. Even if it's that their stay is 5 to 7 days, let's make a positive difference.
Right.
Let's make an impact. I always believe that if you sow a good seed, you reap a good harvest. And so we try to sow as many good seeds in these patients as possible. Now, we may not see it while they're with us, but that good seed will come to fruition afterwards. And our goal is really the highest patient care that we can possibly provide. Each patient deserves our respect. And that's another thing that is a pet peeve and a belief system in our hospital, is that every patient should be respected. I tell our staff all the time, respect you give to everyone. Trust you earn. You don't trust everyone. You earn that trust. But respect should be given to everyone, especially our patients. They're in a vulnerable state. They're in a weakened state, and they need our help and they need our respect as well.
Right. No, absolutely. And I like that idea of the seed. I mean, it's a spiritual thing, and I think that's sometimes something that we don't see in our cold Western medical healthcare system, that a lot of times if you don't nurture the spirit, you can give all the meds you want.
Yeah, it's the holistic approach.
Yeah.
We all have three sides to us, and so our mental health, our physical, our spiritual side. And we try our best to do the holistic approach if we can, but make a positive impact on all patients. And sometimes, unfortunately, patients are there against their will. If they get pink slip, they're not happy they're there, and they want to get out. And we're in a catch-22 because we want to do right by these patients. So we're not able to discharge them in 1 day or two. So we try to get them to buy into their treatment, at least for the next few days. And it's difficult sometimes. That's why you got patients leaving, and sometimes they're unhappy because they felt they stayed too long. But we felt you didn't stay long enough.
Right.
So.
That is interesting. So what's the process of getting admitted to the hospital? Because I know a lot of times patients will call us at Ascend and say, do I need to go to the ER? I really don't want to. Sometimes they'll turn me away. Sometimes I'm waiting there for 12, 24 hours. So what's the process if someone feels, okay, I do need the next step for my mental health?
Well, look, I tell folks all the time, if there's an emergency, you always call 911.
Okay.
But of course, we take walk-ins, and so we have an admitting office that's open 24 hours a day, 7 days a week. And we have nurses, we have licensed clinicians in there. And so we're able to assess patients and see what level of treatment they may require. So if they need to come directly to the hospital, it's not a problem. They don't have to go to the ER.
Okay.
The ER is good if they have an emergency, if they think it may be medical, it's good to go to the ER. But if it's strictly a mental health crisis, you can come straight to the hospital.
Okay. No, that's because it's similar to what we said about restraints, that a lot of times the interventions that we do in healthcare cause their own trauma.
Exactly.
So for our patients, when they've been seen by our physician, I tell them, okay, you're our patient now. If you need anything, you call us first, and we'll see if we can help you or send you along, because other times you're trying to repair what someone else did. Not saying that they're incompetent, but it's a different mindset of.
And it's a challenge because for us that we don't do restraints, we don't tie folks down. Again, it can be very traumatic to be in a situation where you get tied down.
Right.
And so we don't do that at all. We try to verbally de-escalate the patient, and we try to medicate them if they are in need of it. But we think it's the most humane and therapeutic way to handle the patient.
Right.
It's without restraints.
Sure. And then what do you do for treatment-resistant depression? And I also know you all tackle addiction as well.
Well, we treat dual diagnosis. So patients have to have a primary, a mental health problem, but sometimes you don't know who came first, the chicken or the egg. But when we have patients who are resistant to a certain medication, we meet as a treatment team every day. So every day you have all these different departments, nursing, clinicians, the provider, the doctor, the pharmacist, and we meet every day to discuss the patient's well-being. If the patient's medication is not working, then we change it or we modify it.
Right. Okay. And that's honestly part of why I do this show. Is I think this is probably our 45th episode. When a patient asks for a resource, I'm like, well, watch this video, see if you connect with what they're saying, and if so, call them. If not, here's another video, or here's somebody else you can call. And I know it sounds silly to say, like, does this inpatient psychiatric facility vibe with you? But there is a kernel of truth to that, of see if their philosophy and their approach is something that you're thinking, oh, I think they could help me.
Well, there's a lack of education out there in the community. That's one of the reasons I had shared with you earlier that we started a community workshop every month to educate the community on mental health and try to decrease that stigma. And so, I believe a hospital should be a resource for that community. And so, for example, in December, Christmas is supposed to be, and of course, New Year is supposed to be a happy time. But for a lot of folks, it's very depressing. If you've gone through a divorce, you've lost a loved one, you're not financially able to buy those gifts. You go through what I call, it could be seasonal depression, on-site depression. We want to do a workshop in December, overcoming grief during the holidays, because that's extremely important for the community. We want to be able to teach on signs and symptoms of mental health, signs and symptoms of depression, how to de-escalate a family member who is in crisis. All those areas is what we're going to be touching on and offering for the community on a monthly basis. For free.
Will those be held inside the hospital?
Yes. Yes. Well, they'll be in a hospital, and we'll be able to even have as much as 100 folks if they want to come. So we're not going to have a problem in space.
Sure. So someone can just Google Sunrise Vista or Sunrise Vista Behavioral Health, and then the information will be on the website.
Well, I'm not sure yet. Since it's so new, it's not going to be on there, but they can call the facility. And they'll be able to, immediately know what workshop and what time and what day.
Right, and what the resources are.
Exactly.
Because you're right, it's quite something to go from nothing to, okay, now I'm inpatient. But if you're already used to the resources and you've seen the staff around, then if you do have a crisis, it's a little bit of an easier transition, for sure.
Well, I think every facility, especially dealing with people's lives as in mental health, it should be more than just inpatient facility. They should be a community asset. And so, for example, we're trying to put together a coat drive and a blanket drive for the homeless. There's a severe problem with homeless folks in Canton, and so we're trying to do our best to be able to support those folks by even doing a coat drive, a blanket drive, and again, trying to make positive change.
Sure. And sometimes that is a challenge between safety and this quality of life that we talk about all the time. That we want you to be in this unit where you're safe, but a lot of times we have to think, well, wait, what's the end game here? Like, are we just keeping you from killing yourself? Like, is that the only goal here? How can we restore some quality of life?
And that's our passion. You touched on what our passion is, and that is when a patient's admitted, our first goal, our primary goal is to make a difference in that patient's life. If they're suicidal, we want them to leave with knowing that there's a worthwhile reason to keep living. If they're going through a difficult time, we want to be able to help them, maybe not resolve it, but put them on the track to resolve it.
And that way they can also make their own decisions. Like we were talking earlier about ECT, that we see that a lot at Ascend Health Center because we have patients who nothing else has worked. We'll do ketamine infusions, Spravato, which is a nasal spray, TMS, and then sometimes, actually I think 3 different times in the last 5 years, you've been like, you know what, none of this is working for you, let's talk about ECT. But sometimes that can cause memory issues. I've done the anesthesia for ECT, so I know how that goes as well. So it just comes down to, okay, what goal are we trying to reach? What are we willing to do for it?
And are they realistic goals?
And honestly, I think one of the most freeing things for a patient is to say, you know what, if I do this and this, I'll feel this % better, and it's not worth it for me. It's almost like the analogy I use is there's a chocolate cake in your fridge and you're not on a diet. So if you want to go have a slice, you will, but there's no fixation on it.
Exactly.
We do that a lot actually with the ketamine infusions, where some patients, their mental health will deteriorate back after they stop them, but because they know they can come here if they need to, they're like, actually, I'm going to work through this. This is fine because I have a safety net now.
Good point.
And I think what you're saying too is that Sunrise Vista can be that safety net.
Yes, and it can be a support system, safety net. It can be a resource for you. Mm-hmm. So you're able to make better choices and decisions concerning your mental health.
Right, because if you're living in fear all the time, then you can't get better. It's always like, oh, am I going to have another psychotic break?
And you're not experiencing quality of life.
Right.
Exactly.
Mm-hmm. So, and I think that is the most important thing. We can remove that fear. If patients realize, okay, someone has my back, then they can do things, they can take risks, and they can know that, okay, I'm not here all by myself. And that really reduces the chance of spiraling, especially as you said during the holidays.
Yeah. And mental health affects all the areas of your life. And so if your mental health is not healthy,
right.
it will affect all of the areas of your life. It will affect your family, your interactions. It will affect your job. That's why it's so important to make sure that you have a healthy mental health. Mm-hmm. And most of us take it for granted. We go through traumas. We go through childhood traumas. We go through, there are women who have been raped, who have been abandoned, who have lost loved ones, lost husbands after 40 years of marriage.
Right.
All this affects your mental health. Mm-hmm. That's why I believe in counseling. I believe in, if you've suffered a trauma, go to counseling, get that trauma resolved, because it doesn't go away by itself.
Right.
You have to face it. And so whether it be in counseling, whether it be in IOP, PHP, or inpatient, you cannot ignore your mental health.
Mm-hmm. Yeah, I had one patient who said, well, I'm depressed and here's the reason why.
Correct.
And I told her, like, this is great because before you were just depressed, but now it's like something bad happened. I'm having the appropriate human response to it, but I can sort of see, okay, one day I'll get over this thing that happened and then I'll move on.
Correct.
And I was like, that's exactly what we want. We don't want you to be so numbed with the medicines that you're, going through things and just tolerating them. We want you to have the typical ups and downs of life.
And that's why
in a good way.
Medication management is extremely important, especially if you go into a hospital. To evaluate a person's medication, even in the past, is extremely important because, again, what worked for a patient last month, last year, may not work for a patient today.
Sure.
And we don't want to overdrug them either. We want to make sure that they still keep that quality of life and they're able to make choices and eventually decrease that medication if we can.
Right. The ability to make a choice of
exactly.
not being in a survival mode all the time makes
Correct.
a huge difference.
Correct.
And what you said about counseling too, it is almost that helps pinpoint what we should work on. One analogy, and you should be careful because I make up these analogies all the time and they don't always make sense since I make them up on the spot. But if you're complaining of, oh, my feet are numb or I can't see that well right now, it's like, well, no, if you're a diabetic, we need to get your blood sugar under control. We shouldn't worry about the neuropathy as a primary focus or these other symptoms. Like
worry on the root cause.
Right, exactly.
And that's what counseling, inpatient, that's what it does. It actually goes down to the root cause, not just the symptoms. Because if you treat the symptoms, the cause will still be there. Symptoms will come back.
Right.
You've got to treat the root cause. And we try, again, as much as we can within 5 to 7 days. And that's why aftercare is so very important, the IOP, the PHP, so we can continue to tackle that root cause that caused you to be in this situation.
And like you said, it's, when you involve the patient in that process, when you're saying, okay, together we'll find the root cause, and then you're going to be the primary driver, because again, your mental health,
exactly,
it is still everyone's own responsibility. We can come alongside, we can help as we can, but apart from 24-hour care, it's like we'll help you find that root cause, and then here's some, as we started the show with, here's some baby steps of how we can start addressing it.
And it's your mental health is your unseen challenge. That can materialize in a negative or positive way, but it's an unseen challenge because we don't see it.
Right.
We feel it. And sometimes even our own feelings betray us.
Absolutely. So again, if you have been watching this and you feel that any of it's useful, we usually have the medical disclaimers that this isn't medical advice. Really nothing like you watch on the internet should be, but still, if any of this resonates with you, Ascend Health Centers in Fairlawn. We see patients all over Ohio. We do psychiatry, counseling, allow treatment-resistant depression treatments, such as ketamine, transcranial magnetic stimulation. And why don't you just talk for the last minute about how to reach Sunrise Vista Behavioral Health if someone has any problem or if any of this, like I said, resonates with them?
Well, they can reach the hospital directly. We have both 1-800 number and a local number. We're open 24 hours a day, 7 days a week. And again, we have a hospital that I would consider a great place to have treatment. We've made so many positive changes. In a hospital, you never get to a place where you feel comfortable. You always want to continue to improve and make changes that'll be beneficial for the patient. So our biggest challenge, our biggest goal is quality patient care. And so by all means, if you do have any mental health needs, if you feel that you have any questions, call us. We want to be a community resource to you as well.
Absolutely. Well, thanks for being on the show today.
It was my pleasure. Thank you so much for having me.
Absolutely.